Countless women suffer from an itchy vagina. We're talking hundreds of thousands of women in the United States and millions in the wide world. Now, itchy vagina is not as simple as it sounds. Itchy vagina, and I do mean the condition that is persistent, not just the occasional itch that's come and gone. I'm talking about persistent itch that's lasting and sticking with you for many weeks, for many months, and sometimes even years. In many cases, it is not a straightforward diagnosis and approach to take care of the solution. Obviously, you're well aware of that if that has been a problem for you for a long period of time. In this video, I'll present the leading causes for itchy vagina. First off on the list is candidiasis, or candidal infection of the vagina, or more commonly known as yeast infection. That is an infection of the vaginal canal and possibly the surrounding skin. Yeast infection can come up all by itself. It can be a result or associated with treatment with antibiotics that change the makeup of the bacterial flora and alter pH conditions in the vagina. And it can be a very bothersome thing for the sufferer, causing white milky discharge. Sometimes there's a little bit of odor. It can lead to symptoms of UTI, meaning burning and urgency when urinating, and it can itch terribly. So yeast infection of the vagina needs to be taken care of very decisively. First of all, it does need to be diagnosed. If it is a recurring issue and it goes away with anti-yeast medication, that's fine. But if that is a new condition to you and you just assume that it's a yeast infection, you're better off seeing either your primary care, your OB-GYN, or your board-certified dermatologist to make sure that indeed that is what you have and the treatment matches the condition. Another common cause of itchy vagina is vaginitis or vulvitis. That is irritation of the vaginal mucosa or the vulva, meaning the skin surrounding the vagina. And that can be very, very itchy. There are numerous causes that can actually lead to irritation of the skin over the area. And we're not talking infection. We're actually talking factors that can irritate the skin for whatever reason and can lead to symptoms such as redness, burning sensation, itch, and pain. Now, there's the category of allergic contact vaginitis, which means that the condition is caused by factors or products that are applied directly to the skin to which the immune system is sensitive, thereby launching an attack and making the area inflamed with the itch, with the burning, and what have you. There is irritant contact dermatitis or vaginitis that is caused by irritants, meaning ingredients or factors in your skincare routine or general practices are irritating the area either by physical friction or by chemical abrasion, and that can make the area very inflamed and sensitive. The ultimate solution to vaginitis, either allergic contact or irritant contact, is obviously withdraw the offending agent if you're aware of what's causing the issue. And then treatment needs to be applied to the area, or in very severe cases, systemic treatment with steroids and other agents may be the solution to your problem. Lichen simplex chronicus is a step up from vaginitis. It is a condition that is characterized by thickened skin over the affected area, and that thickened skin is a vicious cycle of irritation, meaning it's thickened and it is irritated and itchy continuously, and that is something that's not going to go away with withdrawal of any offending agents. In fact, in many cases, the original offending agent is long gone. What's left is the Lichen simplex chronicus over the affected area that keeps getting scratched and irritated, thereby perpetuating the condition. So withdrawing the offending agents, if there are any, is one step in the solution, but obviously this condition will not go away on its own, and it does many a time require topical treatment, most commonly with topical steroids. Psoriasis is another condition that can cause vaginal itch. This is a condition that is idiopathic, meaning we don't know what is the cause. There are some genetic factors affecting whether or not you can get psoriasis or not, but ultimately the person getting it suffers from it, and the condition is not one to go away. It can be driven into remission with the appropriate treatment, but ultimately it will come and go and affect the sufferer for most of their lives. Psoriasis can lead to red, flaky areas on the vulva and can lead to itch on some occasions. The treatment in many cases, especially if it's a local issue, can be applied by topical medication, and in more severe and resistant cases, there is a need for systemic treatment. Another condition that's affecting the area and can cause itch is seborrheic dermatitis. Seborrheic dermatitis, I've spoken about this condition in previous videos. This is a condition that is thought to originate in a sensitivity that the sufferer develops to yeast that are found naturally on the skin. That sensitivity can lead to irritation over the affected area, and it usually affects areas that are what we call seborrheic areas. So it can affect the scalp, can affect the face, the armpits, sometimes the groin area, and the privates in both males and females. Seborrheic dermatitis appear as salmon pink areas that are sometimes flaky and scaly and can sometimes be itchy or burning. The treatment, especially if it's a local issue, can be applied by topical antifungals, and in many cases, this condition will respond and will be made better by application of topical steroids. Folliculitis, or inflammation of the hair follicles, is a pretty common condition that can affect the vulva, especially the labia majora and the groin area. There are many different causes to folliculitis. It can be idiopathic, it can be bacterial, and it can be yeast folliculitis. These are some of the leading causes. That being said, this condition, especially if it's leading to recurring issues and the symptoms, needs to be evaluated, diagnosed, and treated by an expert. Tinea, cruris, or fungal infection of the groin and the vagina, or jock itch. That can be another condition that can affect the area and can lead to itch, especially in physically active women, in athletes. And that can affect the scaly, red, and itchy areas, affecting the groin usually and extending to the vulva and the vagina. Jock itch, or tinea cruris, is a condition that must be diagnosed and treated in clinic, and in some cases it will require systemic treatment with antifungals for it to go away completely, because in some cases the fungus may invade deeper into the follicle level to which the antifungal topically may not penetrate. That will require aggressive treatment for the condition to go away, and I suggest you see your board-certified dermatologist for that. Primary itch, or itch without a rash, is also another condition that can actually affect the vulva and the vagina. This condition is not that common, but it must be distinguished from other conditions that are causing itch over the area and treated appropriately. If you are experiencing itch and there's no rash, there's no changes over the area, obviously make sure you check with your board-certified dermatologist to make sure there's nothing else going on. The dermatologist will evaluate the area after speaking with you, will determine whether or not there is a skin condition that's affecting the area that's visible on exam, and if needed, they will do additional testings to find out if there's anything that's invisible to us but still going on the area, and make sure that there's nothing else that can be treated and be made to go away. If there's nothing else seen on exam or testings, the conclusion is that this is what we call primary itch. Primary itch has several approaches that can be employed to treat it. You have to distinguish it from any other condition that's causing the itch in the first place. Once that's done, you have a few options available to you. Again, very important to exercise those options either through a dermatologist and in some cases through OB-GYNs that are specialized in treating the skin of the area and issues that arise on that skin. But let's talk about what can be done to avoid making your situation worse. Well, first of all, avoid doing any harm to the area. Very, very importantly, do not apply things to the area that may be making your condition worse. That means avoid cleansing to the best of your ability, avoid scrubbing to the best of your ability, avoid applying any skincare products that you're not sure if they need to be applied to the area in the first place. Even if you think you're treating your condition, you may want to back away from that product. This product may be making your situation worse, specifically antibiotics or antifungals. Disinfection of the area is definitely going to irritate the area further, so avoid doing that. Avoid using wet wipes or wet naps or baby wipes. All these products can potentially irritate the area. They may be causing or making your condition worse, so avoid using them in the first place and let the area rest. Using Vagisil over the area, Vagisil may be making your condition worse as well. So do your best to avoid applying anything, even if it seems like the best idea in the world. You're better off not applying it in the first place unless you're absolutely certain that it's consistently making your condition worse, and it better make your condition better to the point where it actually makes it go away. Most skincare products that are available over the counter will not do that, so you have to find a solution that is definitive and significant to the problem, and for that I recommend seeing a dermatologist. For more information about sensible female genital care, watch my video about the subject at the link above. If you've enjoyed this video, share, like, and subscribe. Put a comment in the comment section and let us know what type of vaginal itch are you suffering from and how have you been able to make things better for you. More great content coming your way right from this channel. Thanks for watching, and God bless.